Welcome back to Conversations at the Summit, a podcast brought to you by Climb UK. On this episode, how life sciences are becoming big business.
I worked for NHS for 13 years, and I'm really, really proud about that. That has shaped my values. That has shaped me, the way how I interact with the companies. And NHS brings quite a lot of values inside you. Very often companies come to me and they tell about their concepts. So they tell about their innovations and they have to trust me. So I have to be really, really transparent and I have to be honest with them because they're trusting with their baby. You know what helps? My accent. I predominantly serve companies from across other countries. And when they speak with someone that also had to make the journey in the UK, they seem to trust me.
Well, joining us is Dace Dimza-Jones, who has quite a job title, National Life Sciences Inward Investment Specialist for the Department for Business and Trade, and also, as ever, from Climb UK, Gordon Bateman. Dimza, that is quite some job title. I'm going to start with one little bit of it, of what are life sciences?
Oh, I hope that you never ask me this question because it's so difficult, even though it's part of my title. But what it really means for me, life sciences, is working with innovative companies across pharmaceutical, medtech, digital health that are working on innovative treatments for our patients, making their life better, healthier, and making our patients or our populations wealthier. So it could be companies developing labs, it could be scientist groups innovating drugs and revolutionary treatments. So that's life sciences for me.
A pretty broad spectrum then
indeed,
of stuff. What exactly, that was one hell of a job title that I read out. What do you actually do?
I hope I am a little guardian angel for international companies across medtech, digital health, pharmaceuticals, engineering, biology, who are interested to set up their UK presence, UK company. It could be virtual office for digital tech companies that has, for example, AI innovation to help to improve your mental health. But it could be drug company that wants to set up their medical drug manufacturing facility here in the UK. And I help them to find the appropriate location. It could be Leeds, it could be Liverpool, Newcastle, Manchester, or London. I help them to link with the NHS ecosystem, with the doctors, key opinion leaders. Pretty much every company I work with, when they come to the UK, they want to sell their drug or device to NHS. So working with NHS is crucial. Then I tend to link them with local universities because it's quite interesting. Some of the companies, they're very well known. Their drugs or devices are very well known and sold across the world. But they're not necessarily available for UK patients. But when they come to the UK, they usually have to do this clinical studies, proof of concept studies. Some people call them pilots to prove that in the UK healthcare setting, according to our clinical care pathways, the drug is safe, it could bring value to NHS, and it would be efficient for NHS to use. So it's quite complex. And then many of the companies, when they come to the UK, they have no money. And they are looking to raise investment. So I also work with VCs, angels, banks, government funders such as NIHR and Innovate UK to find this funding opportunities for companies to grow.
What about your own journey? How did you end up in this country?
Oh, goodness. It was love. I very stupidly followed my husband. And now I'm really, very happy I made that decision, but it was crazy. I don't know if I would do that again. He decided to do media studies in Salford. And he said, are you going to come with me? I was young and I had an amazing career back in home in Latvia. I worked for government and I reported to WHO. At the age of 22, that was incredible. But I said, yes, I'm going to give up everything. I'm going to come to the UK, even though I can't speak any English. I will start to work at shop as sales assistant with my amazing education. Yes, and I said to him, I will come for 1 year. And yeah, I'm still here after 17 years.
So how did you get back into what it was that you loved doing once, I guess, you'd learned how to speak English?
I suppose it was, I had opportunity to work at the laboratory, a very basic job, medical laboratory assistant at Salford Royal Hospital. And I thought that I really, really need to get in NHS. And for me at that time, it was 2009. It doesn't really matter what kind of job. I really, really wanted to be part of NHS. And actually, I failed at my interview. But then I think it was about 3-4 months, they rang me back and offered position. And quite interestingly, one of the reasons that I failed for the jobs that would have been appropriate at that time was that I was overqualified. So I came to the UK, prepared the best CV, put all my qualifications and experience. I had quite a lot of volunteering experience as well. But you had to have different approach. You kind of not overselling yourself. At that situation, I had to learn how to undersell myself and not to sound very clever when you go for band 2 NHS interview. But yeah, that was reality.
And you worked your way up through that,
Yeah.
and worked physically on clinical trials, didn't you, particularly during COVID?
Yes, a couple of years I worked in labs, and I did shift work, and it gave me opportunity to finish my master's in public health and environmental health. And then there was a job advert about clinical research. And I remember one of the first days, one of my colleagues took me around Clinical Sciences building, Salford Royal Hospital, and she said to me, "This is the building where the brains of hospital live." So all the doctors, nurses who are involved in clinical research were there. I met them in corridors. So it was not, very greatly paid job. It was band 3. But for me, it was heaven. It was my next step that, I'm here inspired by those amazing people, pipetting specimens in the same labs. It was absolutely incredible. And some of the people, when I climbed a little bit in the NHS, they said, "Oh, you need to get out. You're too good for NHS. You need to go and work for industry." But I actually persevered and grow within NHS. And I'm quite grateful to myself that I had that foresight, not to just jump to the next well-paid job. But I worked for NHS for 13 years, and I'm really, really proud about that. That has shaped my values. That has shaped me, the way how I interact with the companies. And actually, I think I can help more to international companies because of my NHS background. And NHS brings quite a lot of values inside you. Because when you are involved with the patient, it's not about you, it's about the patient. What you can do in your capability to help. And, standards of care, clinical staff, they're very well trained. But when you are involved in research, you can bring a whole other role to the patient. You can bring those alternative treatment methods. You can bring hope, and you can make those patient lives much, much better.
It's interesting, isn't it? Because when we talk about growing businesses and leadership, passion is like number one. And I think that development that you have in the NHS and the ability to get access to that, but then stick with it. Yeah. Makes them, because it oozes out of you, your passion for everything. When we talk about any element of life sciences, your passion for it. And I think for a lot of people, it is just too easy to think, I'll come out of that environment and just go and get the bigger paycheck. For staying in it, and that development you get does make a difference.
Absolutely. And it also, NHS, when you are in research, it's not always the 9-to-5 lifestyle. Sometimes you have to come very, very early. You deal a lot of unexpected situations. You have to ship patient samples. Couriers are late. So you have quite a bit of crazy life, but the values that you develop, it's incredible. And now I'm quite skeptical about any job offer I have from the industry, because they are getting not just my skills, but they're getting my ethical values. I hope it doesn't sound too, patronizing. But for me, it's been investing time and sometimes giving my family's time up for, giving back something to society. And that is something that I didn't mention, but I also volunteered in NHS on the elderly ward for a very small amount of time. But that was a really big eye-opener to just being patients, not being paid, but being there and looking what an incredible job nurses are doing. Obviously, our doctors are amazing, but not just nurses, but also clinical support workers, porters. Those people that kind of, they blend in, they're gray, you don't necessarily see them, but they are beating heart of the hospital.
One of the other things that strike me is if you're doing those clinical studies and research, the relationship you have to build up with the patient must be very intense. And also, presumably, they don't necessarily know whether they're on the drug. It could be a placebo drug. I mean, how do you go about building that relationship, and how, having done that, has that helped you now?
You know what? It's about the trust. And it's same. Can I go back to my work and I will answer your question? I support life science companies. So across medtech, digital health, pharmaceuticals, and I work a lot with SMEs. And very often companies come to me and they tell about their concepts. So they tell about their innovations, and they have to trust me. So I have to be really, really transparent, and I have to be honest with them because they're trusting with their baby. We are not, when I was in NHS, we signed NDAs. In my day-to-day job, usually we don't involve NDAs. It is frank and honest conversation about their innovation. This is something that NHS needs. If this is something that they can bring in for the UK life science environment, set up their company in the UK. So that trust is really, really important. And it's about, I work a lot with international companies. So FDI, foreign direct investment, means that I work specifically with foreign-owned companies who are interested to bring their innovations and businesses here in the UK and set those clinical trials up, set those companies up. Going back to trusting and patience, it is that when it comes to clinical trials, you can't pressurize patient to be in clinical trial. Even in your opinion, that's probably best way for certain patient groups. You can't absolutely do that. It's patient's choice to be in the clinical trials. Sometimes what's really scary is I used to recruit patients as well as part of clinical studies, that family make decision for patients that, I want my mom to be in this trial. But it's not about your mom or your dad or your husband. It's about you. And you have to have that intimacy between your patient and yourself, and transparency. And sometimes you just have to let it go, not to recruit some of the patients in, but be absolutely honest and clear about, that patients can trust you.
I was going to say, it's such a complex world, isn't it? That if you're not embedded into it, and that, going back to that comment you made earlier about trust, it's winning people over. How do you do that? Because as you say, it is somebody's baby and you're not using NDAs anymore. And how does that work? How do you connect with people and get them to open up?
You know what helps? My accent. Because obviously I try to improve my English and I try to be more native, but then again I gave up. Very clearly you can say that I'm from Eastern Northern Europe, and I predominantly serve companies from across other countries. And when they speak with someone that also had to make the journey in the UK, they seem to trust me. And then again, sometimes, and actually quite often, when companies come to me, I would tell them straight away, UK is not the right market for you. I like your innovation, but you may succeed, but not maybe in an NHS setting. About 10% of care in the UK is delivered by private healthcare companies. So maybe your innovation would be more suitable for one of our private healthcare providers, but not for NHS. So I try to be as honest as possible. But then again, I say, don't take my advice for granted. Seek second opinion and then make your decision. Because my biggest worry is that company will come to the UK, spend a lot of money, and will go back home disappointed. And then then we will not gain good reputation. And I want to be the place, I want to represent government that can be trusted. Organization where companies can have this open conversation and, bring value if they come and set up their presence here in the UK.
But that's critical because international growth, whether it be inbound from international companies coming to the UK or UK companies wanting to expand internationally, is massive at Climb this year. It's one of our biggest subjects. But the reason why it's one of our biggest subjects is there's a lot of people who aren't like you and they're not being honest and they just have sales targets to get companies here or to get people overseas. And it's a huge amount of time, isn't it, from making a decision that you want to come to the UK to actually landing here and being effective.
Absolutely, you're right, Gordon. But can I say about international companies what I have observed? It's quite interesting when you speak with highly educated, intelligent CEOs of these companies. You know what they've got? They have very developed gut instinct. And I have to say, they use their gut. So what I say to some of my regional colleagues, I understand that you have targets. You have to create certain number of jobs. You have to bring certain million of investment in. But at the end of the day, you know what? It doesn't really matter for that CEO. For them, it is to build that trust. And they not just using their intellectual brain capacity, they also use their gut. So, you can't fake it. And you know what? This is quite there is a saying, you fake it till you make it. This is not something that you can use in life sciences. And I would never advise this for life science companies who want to get into the NHS, who want to get into our UK life science ecosystem. Absolutely no. Sometimes it's rather, fail 17 times and succeed one, but not the other way around.
And when you're working with these companies, I mean, the government has just announced a big investment into life sciences and they've cut down trial times. I mean, how does that make your life easier?
Absolutely.
Are you being pushed to the front in a way that you haven't been maybe before?
Clinical trial times and setup times, they're really, really crucial. And why? It's not just every day when the drug can't be trialed, it costs enormous money for the pharmaceutical companies or medtech companies or digital health companies. But it's also about patients. What we want when we work with innovative companies, we want to get these trial opportunities for our diverse patient population as soon as possible. Every time it takes for regulatory authorities to sign paperwork off, it prevents patients to get better. And also, specifically with commercial clinical trials coming into the NHS, it brings a lot of investment for the hospitals. So it makes hospitals financially better. But then again, commercial clinical trials, they're protocols, they're really, really innovative, which means that nurses, clinical care workers, doctors, we call them PIs and CIs, that are going to be delivering trials, they need to learn and they need to upskill, which is again really, really amazing. And it has been proven that those hospitals and organizations who are involved in clinical trial delivery, the healthcare outcomes for patients are better than for those hospitals who are not active on clinical trial delivery.
It must be exciting.
It's really exciting
to be involved with something that may make such a difference.
And you know what? It's not just about hospitals. We talked a lot about secondary care settings, but what we are doing here in the UK now, we have these research runs, which means that they are like mini hospitals, mini clinical trial research units that can travel to patients' homes. Not everyone lives in city centers or near the hospitals. Not all patients can travel. And some of the patients even don't like to come to the hospital because, they're scared. Or many of my family members, their stomachs turn when they step into the hospital, so we can bring these opportunities closer to patients. And then again, I didn't mention about our GPs. So GPs, primary care, also deliver a lot of really, really important trials, even vaccine trials. And we also have community pharmacies and our social care organizations, such as hospices and care homes. Some of them are also research active and are involved in developing new treatments, bringing new medtech innovations and digital health solutions to the market. Can I just also mention about something really, really unique? And I think this is globally really unique. What we have in the UK, we have this NIHR, National Institute of Health and Care Research. They have this VIP, Vaccine Innovation Pathway. So again, something really, really amazing. So if there are companies out there working on vaccines, both for infectious diseases like COVID or flu, and also working on vaccines, on oncology, on breast cancers, colorectal cancers, skin cancers, there is accelerated pathway in the UK where you make your all regulatory submissions and you really, really quickly, even within weeks or days, you can get those innovative trials to the patients. So this is really, really unique.
Some people might say, why do we need all these foreign companies coming into the UK? You've answered a little bit of that previously, saying it brings money to our hospitals and our NHS. But why is it so important that we bring all these businesses and these research organisations from overseas into the UK?
I will do other way around. So why international companies would like to come to the UK in the first place, if that's all right. So I work a lot with Central European countries, and they have fantastic innovative treatments, let's say for breast cancer or cystic fibrosis. But what many of these countries don't have is a diverse patient population. So here in the UK, we speak more than 300 languages. It's amazing. Even here in Yorkshire, I think it's something like 200 different dialects. That brings opportunities to trial these new innovations on diverse population. Traditionally, what has happened, drugs had been treated on white British male. But white British male, it's not our society. You take some part, but we have so many. We have female, we have pediatric patients, we have people speaking different languages, different people from different socioeconomic groups. It's really, really important to treat innovations on as many different ethnic minorities, socioeconomic diversities as possible to make sure when these drugs go out to patients, they work. They just don't bring benefits for white British male, but they bring benefits for everyone, and it's safe to use for everyone. And for example, let's take breast cancer. GP, when they check female breast, the breast cancer for white patient can be so much different manifest than for black women. And it is really, really important that we start this dialogue, that we all are different and the diversity needs to be included in clinical trials. So that's one of our biggest gain, why companies come to the UK. Then again, obviously, NHS. We have our NHS digital records. We have access through our amazing biobanks. And at the end of the day, our research infrastructure, when companies have opportunity to be part of Leeds Teaching Hospital or Manchester Foundation Trust or Liverpool, they have that opportunity to utilize the equipment that may not be available in their own country. And here in the UK, we have 4 best universities out of 100 for health, life sciences, and medicine. So we have that amazing academic brain power for companies to come here. Why we want international companies? Like you said, we want to create new jobs. We want to we want to bring investment in. If we will have money coming in through innovative life science companies, we could, grow to reinvest in other subsectors. So it's really, really important. But then again, at the end of the day, it again goes to patients. Those innovative treatments that companies I'm working with bring in, they can save lives. They can improve lives for so many patients. So it's really, really crucial that we work with these international companies and make them feel welcome when they come to the UK. Because imagine, it could be really, really scary from their side. Some of them, English is not their first language, so sometimes it is to breaking that barrier that they sometimes feel embarrassed even speaking English. And then, NHS, 215 NHS hospital trusts. I think last time I checked, more than 6,000 GP practices, 42 ICBs. To navigate even NHS, it's so complex, so difficult. And then again, let's say if it's company from Estonia and Poland, it is so much more expensive for them to run that clinical trial in Leeds or London than it would be in Warsaw or Tallinn. So we need to take into consideration that for them, even when they come here, run the trial, it can fail. And potentially 90% of the cases it will fail because that's science. We unfortunately very rarely succeed, but when we succeed, we are winning. And it's a really difficult journey. And then they're running out of money and they need to secure that funding to, scale up. And then again, navigating funding landscape through private and public funding opportunities, it's really, really hard journey. But they don't moan, they get on, they build their resilience, and it's amazing. It's see how they grow, and it's truly inspiring.
But there might be people who say, with the new funding that's coming out, why is that not going to UK companies? We're resource constrained or whatever. Why can't we invest purely? Why do we need to? What's in it for us as the UK to bring in a company from Estonia? Yeah. I get what you're saying about that gives us better research for our patients, but could that not be done out of Oxford University or a UK-based firm? What would you say to those people who might be sceptical?
Absolutely, it could be. But then again, bringing those Estonian, Polish, USA, Indian companies into Leeds, for example, it creates jobs. And we want those jobs, don't we? And then again, it is about that investment. In theory, it will go back to the NHS because those treatments we are trying to bring into the market in long term, they will save money for NHS. They will cut the waiting lists. They will make our NHS from, how Kirsten said, from analog to digital. So this is what it is about. And we should really, really embrace that. And again, for our academia and NHS, it gives that innovative opportunity to work on something truly unique.
You've stayed in Salford.
Yes.
So you came to Salford, you followed your husband to Salford, and you've stayed in Salford, which is actually a quite important part of your story, isn't it? That the North and working in the North and researching on people in the North is very important to you.
Absolutely. And I live in the middle of Salford, and people that I see around my streets, their health is not well. Absolutely not. Mental health, a lot of obesity, addictions. And a lot of people have asked, why don't you move out and go somewhere posher? But for me, I think if I, let's say, go to elderly age, I will start to feel a bit like fraud because I'm so passionate about, the population where I live in and what they're trying to do. My kids go to school in Salford. The parents, they're trying to do absolutely best for the kids, for the elderly parents, that they can do what's given to them. So for me, actually, Salford is really, really big inspiration. I finished Salford University, and for so many years, I worked at Salford Hospital Trust. And working for Department of Business and Trade, this gives me opportunity to say companies, before you bring your innovations in, before you set up your businesses, Golden Triangle, London, Oxford, Cambridge, amazing. Go to London nearly twice a week. But why don't you come closer to your patient population? Why don't you come to Salford, Leeds, Sheffield, where we have one of the highest rates when it comes to diabetes, cardiovascular, respiratory diseases. Why don't you come to the region where you can make most of the difference? So that's my saying.
At Climb this year, you're bringing 20 companies, 20 life sciences. Some will be digital, some will be other areas of life sciences.
We don't know who is going to apply yet. So,
so who do you want to meet? Who do you want from the UK to be in that room, to be in that event? And why should they come and meet your 20 companies?
First of all, NHS. Because, again, it would be fantastic for our key opinion leaders across more than 30 therapeutic areas, from oncology, cardiovascular, renal health to pediatrics, to spot those collaboration opportunities with these innovative companies. I'd love to see representation for health innovation networks. So health innovation networks are an innovation arm of the NHS, and they're really, really crucial help for SMEs when they come to the UK to navigate our healthcare system and funding landscape. I would love to see patient representatives. So I would love to put those companies together with someone who suffers from cystic fibrosis or mental health disorders to speak with those companies. This is, again, something unique for the UK. This is not something that I have at such a scale witnessed in other European countries. We are all about our patient and public involvement, and at every angle of the company development, support, clinical trials, pilots, we try to bring through patient's voice. And I want to highlight this to the companies because, if I'm honest, not every company that I serve, not their first ambition for them is to help patients. For certain markets, is to make profit. Nothing wrong with that, but we have to be clear. If you will want to work with NHS, then patients will need to be your priority. And then, of course, I would love to see VCs, angels, people with a lot of money, and who are generous, who are forward-thinking, who would be excited to meet companies from potentially across 6 to 8 Central European countries and support them. And it's not just for those investors. It's not just about cash. It's about the knowledge and help to give their advice, help, and experience to help them navigate our ecosystem.
And are there any professional services companies like contract research companies who should come and meet you? Who else? What's your wish list to die for a Climb of people to meet?
Oh, contract research organizations, absolutely. If they're local lab providers, absolutely. If there are companies that could make life easier when applying for DTAC regulations, sorry for acronyms, MHRA, nice. That would be absolutely fabulous. Anyone really. And then local representatives from combined authorities. Because when it comes to foreign direct investment, local mayoral combined authorities play really, really significant role. And in the UK at the moment, we have something called investment zones. So in West Yorkshire, we have investment zone for digital and medtech. So I know that West Yorkshire Combined Authority are going to be there. They're helping me to facilitate 2 days in Leeds. So really, really excited about that. Hospital representatives, academia representatives. It's really difficult to say who not to invite.
Amazing.
Just finally, I sit and listen to politicians saying, we can be a global leader of this, we can be a global leader of that, and it just seems like a phrase. Can we? Are we a global leader with life sciences?
Absolutely, we are. We have slightly lagged behind just after pandemic. But when you look what we did during the COVID, we came up with vaccine. But then let's bring many years before. In 1947, 1948, the NHS actually was created here. Probably for many nations, NHS is an example how health should be managed in the country. And it was created here in north of England. First IVF baby in 1978 It was born and conceived in Oldham. And today, what really made tears in my eyes, I was listening BBC News, and there were those two sisters. One sister donated a womb for her sister, and there this little baby, Amy, was born. Oh my goodness, it gives me goosebumps. It's so incredible what we can do. And usually those people... I'm so sorry. Honestly, it brings tears to my eyes. Miracles happen every day. And I think why I love my job is that I have opportunity to be so close to those companies, but then again, so close to our NHS to witness those miracles every single day. And I think that's probably reason good enough to come to the UK.
Dace, it's been utterly inspiring listening to you. Please do thank your husband for bringing you over here, and good luck, because we need people like you to be succeeding for all of our healths. It's been fascinating listening to you. Join us again for Conversations at the Summit.